Morning, morning, morning! Hi there, fellow. You all right?
Yes. Yes, I was just waiting for you to catch up. Have the lifts been miraculously repaired whilst I was climbing up 6 whole flights of stairs?
No, they're still as dead as dodos, with all these damn carts likely to remain so for some time.
Yes. Since this hospital became a trust, the only thing you can trust is there's never enough money to get anything fixed.
Still, I personally find a brisk trot up the stairs a surprisingly good start of the morning, don't you? Going to change?
No. You carry on. No doubt I'll catch you up. Give you a head start.
Come on, Jonathan, you'd love it. 24 hours squashed together in a rally car. Just the two of
24
us.
hours?
Man, woman and machine in perfect harmony. Hearts pounding, bodies vibrating, adrenaline surging.
I'll miss the cricket highlights.
You really are an old carpet cat.
OK. Why don't we spend 24 hours curled up in front of the fire?
Watching the cricket? Jonathan, I'm an outdoor girl. I need fresh air.
OK. We'll keep the windows open.
Maybe I'll keep my options open.
Laura? You all right now?
Yes. Fine. Never felt better. I'm coming!
Hello. Mary. I haven't done anything with Joyce. This is Joyce. You mean to tell me I've just climbed 67 stairs in my trendy new platform shoes? Triple jumped down the corridor just to get to the phone. And you want to know if I'm aware the lifts are out of order? Yes!
Joyce, you look like...
Not a day over 30, I know. It's the lifts.
Well, I think you're brave to wear platforms at your age.
Platforms?
They're your old ones from the 70s.
I'm talking about the lifts.
I don't think it's the lifts that are the problem, Joyce.
Are you saying that I'm heavier than not more than 15 people at a time?
That's a horrible thing to say to someone who's sensitive about their weight.
No, I mean, maybe you're not fit enough. See, I'm training to be a personal fitness instructor, and
You're volunteering to be my private service engineer. Oh, Michael, my body is in your hands.
She's coming.
Mr. Barraclough.
Oh, it is you.
No, it's the Sugar Plum Fairy. Giles, brief me on the story so far.
Well, Mr. Barraclough here is a bodybuilder.
It's a pity he couldn't build you one. Get on with it, Giles.
In March, I think it was.
Yes, it was.
He came in with a hernia, which you repaired.
Which a whole team of us sweated, struggled and strained over like a platoon of sappers sandbagging a burst dike, yes?
You prescribed a course of indomethacin and sent him home.
Expecting never to see him again.
And now he's back again.
In the same bed, in the same hospital, with the same blasted complaint!
Well, no. Before, he only had one hernia.
Yes?
And now he's got two.
Giles, I'd rather not have a witness while I pebble dash Mr. Barraclough. Would you mind quivering somewhere else?
Before you say anything, I'm not a well man.
No, you're not, and I wonder why. If we could delve momentarily into that vast, uncharted wasteland that is your brain. After your last visit, did I happen to mention anything about not going back to strenuous exercise too soon?
You might have mentioned it, en passant.
Yes, I mentioned it en passant, on purpose, and on Tuesday the 24th of March. You've been back to the gym, haven't you?
No.
Then how come your chest is now bigger than my living room?
All right, then I have, but you're the one who said I could.
What I said, Mr. Barraclough, was that any normal person should allow a recovery period of 6 to 8 weeks after an operation of this kind.
Yeah, so I went back to the gym 6 weeks after the operation.
Yes, but you're not normal. You are a bodybuilder who places colossal strain on his muscles. I told you that the most strenuous activity you could do for 3 months was to rub baby oil into your pectorals.
3 whole months?
You see, this is good. If you keep repeating my advice, I won't have to write it on a brick and shove it down your throat.
Do me a favour, what if I lost my definition?
Aye, we are grappling with life's big questions, aren't we? Now, Mr. Barraclough, I believe in collaboration between doctor and patient. The last man who refused to play ball with me is now singing soprano with the Swingle Singers.
I get the picture.
Good. I'll operate tomorrow.
Excuse me, could Kevin retract for me?
He's retracting for me. He can't retract for everyone. Can't you retract yourself?
I haven't got a retractor. Could I possibly...
Oh, for crying out loud. I thought the whole point of you two doing a hernia each was to get it over with quickly. Wham! Finished. Then we all piled down the staff canteen for a chili con cock-up and a plate full of listeria. We have now been here for 45 minutes.
Well, you're not doing anything. Why don't you get on to sterile supplies and ask what's happened to our other 4 Langenbecks, 2 Alice forceps and a Babcock? We're trying to work here without a full set of cutlery.
I thought you were a professional. A bad workman always blames his tools.
The only tool I am blaming is the one on the table. I mean, look at it.
Sheila, it is not a crime to try and keep yourself fit.
How would you know? If my memory serves me correctly, you are a consultant for Sofas R Us. Anyway, he's not fit. He's got half a ton of small bowel poking through 2 gaps in his groin. I don't call that fit.
Well, I know he's got problems, but there are still big chunks of him that are quite nice.
Excuse me, could
Sister, there are big chunks of Hadrian's Wall that are quite nice and twice as intelligent as him.
I'm sorry, do you mind
All
if
he's done is what we doctors advise people to do. Take regular exercise. Something, I might add, that a lot of doctors don't do.
Well, you don't need exercise, do you? You just get a jump start every morning from Little Miss Everready.
I'm sorry, but I can't do my work if I've got nothing to do it with. I mean, we've got one assistant between the 2 of us. Mrs. Sabatini has all the instruments on her side. And I really think that if I ask for something, someone ought to listen to me and do something about it.
And I'll tell you another thing.
No, you won't. I think it's totally unethical of you to discuss my private life in front of all these people. If I weren't such a professional, I'd drag up your private life. In fact, I will. The only thing you and your Paco have got in common is your old tongue.
Really?
Yes, really. If you both had a man out at the same time, you'd look like a pair of unlaced Reeboks.
Surely we could have borrowed a retractor from next door.
Dr. Haslam, may I remind you that this is an operating theatre?
We did borrow one from next door. She's got it.
I am trying to remould this lump of beefcake.
And may I remind you that this lump of beefcake is a patient who deserves the same respect as anyone else.
I am a qualified surgeon. If I advise someone when the best time is to plant gherkins or how to catch cuttlefish with a ball of string and a yoghurt pot, I don't expect them to listen. But if I say take no strenuous exercise for 3 months, I expect them to take no strenuous exercise, not dash out and attempt to clean and jerk a rhinoceros. I will respect him when he respects me, and not a moment sooner. Where the hell's my retractor?
Oh, I thought you'd finished with it.
Get your own. Joyce.
1, 2. 1, 2.
Don't tell me. You're trying to decide whether to have 1 bag of sugar in your coffee or 2.
It's an exercise Michael gave me to do while I'm working. Did you know I don't have a weight problem? I'm an endomorph.
Who happens to have a weight problem. Joyce, what is this that I just found in my consulting room?
The new operation guidelines.
Dear colleagues,
I think they're trying a friendly approach.
in order to progress our positive policy of implementing a constructive range of non-staff cuts, the Gillies will no longer perform the following elective operations. In other words, operations they choose not to find the money for. Adenoids, bunions, hemorrhoidectomies. Joyce, we hardly do anything else. Our consulting room's a chock-a-block with people who can't speak, can't walk, or feel as if they're sitting on a porcupine.
It's not aimed at you personally.
No, it's aimed at the poor defenceless patient, as usual.
Now, calm down. You'll blow a gasket. You know, you should do what I'm doing. Surprising how relaxing it is.
Joyce, if I wanted to lift sugar, I would go into a supermarket wearing a Mac with false pockets.
Last
blasted lift. It's been out of order for a whole week now, and to cap it all, I have just been reported for using the service lift.
Again? It's supposed to be for the patients, Mr. Copeland.
Well, bully for them. What about us surgeons? Are we supposed to arrive in theatre with an oxygen mask and tank strapped to our backs?
Finding the stairs heavy going?
Me? Good heavens, no. Exercise is my middle name. No, it's the older surgeons I'm concerned for, the likes of George Hope Wynne.
Oh, Mr. Copeland, you must have been so embarrassed.
I'm sorry?
You know, being helped up the stairs by that old lady after you got chucked out of the service. She is 82 years old.
My dear sister, I was helping her. She looked a bit unsteady.
Wasn't it nice of her to offer you a walking stick?
She did not.
Let's be getting on.
No. Michael, just out of interest, I understand you're licking Joyce into shape.
Yeah, she's really into it. You see, the exercises I give utilise work hours.
Utilise work hours? Yes, these exercises sound just the sort of thing George could do with for those stairs.
Mr. Hope Wynne?
Yes, I've seen him hurling himself from one banister to another like he was in a pinball machine. He's a very proud man. I don't think he'd take advice kindly on his physique.
No, of course. He might listen to you, though, if you passed on a few of my tips.
Yes, that might just work.
OK. This is a good one for the calf muscles. Dr. Haslam, you could try this. It'll help with the stairs.
Jonathan, can you spare a minute?
Yeah, it's good, that. Sorry, though, you're going to have to count me out.
And the point is, you can do that while you're walking. It really works, and nobody will notice.
Really?
Oh my God, it's the Kirov Ballet.
Before I say anything, I would like to apologise for insulting... What's her name?
Laura.
Yes.
And I'd like to apologise for insulting,
Packer.
Yeah.
Well, I appreciate that, because I know you don't like him.
I can't stand the nauseating little git.
Any more than I can stand that stomach-wrenching blind date reject you're shacked up with.
Well, that's that sorted out, isn't it?
Yes. Oh, Jonathan. What are we going to do about all this cost-cutting nonsense?
Live with it, I suppose.
I've just had to tell a patient of mine, Mrs. Anderson, that after waiting 18 months, she can't have her submandibular gland removed because we're cutting back on life's little luxuries, and she'll just have to live with her face swelling up like a rubber dinghy.
Well, at least she'll never drown in the bath.
Does anyone know what's the matter with Neil Copeland? I've just seen him walking up and down the corridor like he'd broken a stiletto.
George, you're an ex-director of surgery. How did you deal with impossible demands from upstairs?
What, you mean Grace shouting for cocoa, that sort of thing?
No, management playing God.
Used to toe the line, I suppose, try and see the other fellow's point of view, look at it from all angles.
What you mean is, ours not to reason why, ours but to have an easy life, and if anything happens, make sure it's their fan and not yours.
Yeah. That Neil? Neil! For goodness sake, man.
Jonathan, about tonight.
Look, I'm
I've
talking to
decided-
Sheila. Medical matters.
Oh, grown-up talk. OK, bye.
Grown-up talk. It makes a nice change, doesn't it?
Yes.
You monosyllabic Neanderthal pile of offal, what is the matter with you?
Might be me old trouble again.
Yes, pig ignorance, Mr. Barraclough. When I said no exercising after your operation last week, I meant it!
It isn't what it looks like.
You mean this isn't a lunchbox?
I didn't go down the gym. I did it in the kitchen.
Well, dressed like that?
That's my normal gear.
Oh.
I was busy stirring my buff on dough when I got this urge to do a quick snatch with my casserole.
How strange, I'm having a similar urge myself. Mr. Barraclough, the hospital has told me to cut back on certain operations.
Oh?
They're not saying that yours is one of them.
Oh, good.
But I am. If you refuse to cooperate with me, I refuse to operate on you. I'm sending you home with a truss.
She didn't. She didn't. Sheila, you didn't.
I did.
She did. Oh, my God.
Joyce, why did you just put the coffee into the sugar?
I find sweet things comforting in times of stress. You wouldn't believe how angry upstairs are.
Good.
Good?
Yes, I'm standing up for the Mrs. Andersons of this world who want to get better, as opposed to the Mr. Barracloughs who don't.
Upstairs say there's no question. You've got to do his operation. It's come all the way from the top.
What, you mean a central heating vent?
It's not hospital policy for maverick surgeons to withhold treatment by taking unilateral decisions.
Well, you can tell upstairs that if they have a problem with my unilateral decisions, they can see this maverick in Theatre 4 this afternoon, where she will be deflating Mrs. Anderson's rubber dinghy.
Michael, Debbie and I have given it some thought, and she's decided that I should let you do something with my body.
OK. I'm thinking of starting up a class. I'll let you know when it is.
As long as you leave those sexy legs exactly as they are. Mr. Copeland, is it true what they're saying about Mrs. Sabatini?
Everything they say about that woman is true, even the stories I've concocted.
Excuse me mentioning it, oh boy, but why are you walking like Andy Pandy?
You noticed?
Well, everyone's noticed, and I was wondering if sweating up and down all those stairs had led to a spot of trouble in the gusset.
What?
There's no need to feel embarrassed. I've got some excellent ointment at home. Grace swears by it.
If you must know, I have decided to tone up my calf muscles.
Oh, I see, a spot of gymnastics.
Yes. You see, unlike other people, I utilise my work hours to incorporate a range of sensible exercises. You know, callanetics, knee bends, the odd squat thrust.
Squat thrust?
Oh, yes, it's marvellous. One positions oneself for a press-up, and one's legs shoot back and forth with incredible rapidity.
I don't quite get the picture. Could you show me one? Just the one.
Just the one. Yes,
What the hell's he up to? Well, I believe they're called squat thrusts.
It looks like he's trying to start a motorbike. George, ever seen Sheila anywhere?
Luckily, no.
Look, I'm going to sort out this Barraclough business once and for all. If anybody wants me, I'm up in the ward, OK?
Pass it on, old boy.
did you see it?
See what?
Well, I just did 17. Good Lord, I feel invigorated.
Hey, what's all this? It's supposed to be vinaigrette. If you ask me, it's a dodgy mixture of 3-in-1 and TCP.
You're not allowed to eat or drink before your operation.
Well, I'm not having an operation, apparently.
I'll be the judge of that.
I wish you lot would get your act together. I mean, first, Cruella de Vil says she won't operate. Then Sister says I can't go home till she's checked with the gaffer upstairs. Then the gaffer upstairs puts me on hold, and now you walk in and swipe me nose bag.
Look, let's get to the bottom of this. Why do you keep going back to your exercise before your hernia's had a chance to heal up?
Oh, I don't know. Just got to keep feeding this monster.
Yes, well, you've certainly got a lot of monster to feed. How does it all stop?
Well, it doesn't. After I've done the gym, then I go home. I do a few hundred squat thrusts, a couple of hundred push-ups, then I feel good. Of course, that only lasts an hour or two.
Oh, of course.
I've got to start it all again. In fact, just thinking about it...
What would you do if I physically stopped you exercising?
Oh, you couldn't.
No, I couldn't, no. But what if somehow you were actually prevented from going down the gym?
Well, then I'd work out at home.
No, if you couldn't do that.
Well, then I'd go down the gym.
No, you can't. You can't exercise.
But I have to.
You don't have to.
I do.
Why?
Because if I don't get that buzz, I go crazy.
Well, voila, bloody la.
About tonight, I've decided...
Yes, I know. You're going out, I'm staying in. Now,
Baby cakes, you're not listening to me. Tonight, I'm going to have a quiet night in with my carpet cat.
Laura would at work.
Well, there was a time when that didn't matter.
Well, it matters now. Now, have you seen Sheila? I've got to talk to her.
You'd rather talk to her than me?
Well, right now, yes.
Right, go find her then.
I shudder to think what's going to happen. There's talk of upstairs coming down. Upstairs never come down. I have had to tell them, as Sheila's closest friend and closest colleague, that she is under enormous pressure. A single parent struggling to bring up a medical student, a Latin lover who makes impossible demands on her at all hours of the day and night. And to cap it all, she has to perform the most intricate operations with her ex-live-in lover breathing down her neck while his latest bit of fluff looks on. And it's a good job I did, because they didn't know any of this. Jonathan, you've got to do something.
If you put a swab in it, I will. But, Joyce, leave it to me.
Giles, why did you add Mr. Barraclough to my operating list without consulting me?
He has a hernia, so I thought you'd want to operate as soon as possible.
The man was born with a hernia. If he was anything like the size he is now, his mother probably had one as well.
Sorry, I don't follow.
I am not operating on him. I refuse to operate on him. He will not be operated upon.
Sheila.
Belt up. I'll get round to you in a second. He refused to follow my instructions.
Can I have a word?
No.
Get in here.
I haven't finished with you.
Sheila, you have got to retract all this nonsense about not operating on Mr. Barraclough.
That man does not care about his health, and so why should I?
You cannot pick and choose who you're going to operate on.
Why not? Upstairs does.
Well, I went upstairs, 112 of them I might add, to see Mr. Barraclough.
Jonathan, the man will not let his hernia recover. What am I supposed to do? Patch him up time after time like an old pair of jeans? So he can go off and tear the scar tissue again until there's nothing left to stitch into? The man keeps bouncing back like he's caught his lycra shorts in the front gate.
Have you actually tried talking to him?
Tried, yes. Succeeded, no. How can you talk to him? The man is a himbo.
The man has a problem.
Yes, he's double the size of everything except his IQ.
He's addicted to working out. He can't give it up.
Claptrap, how can you possibly be addicted to lifting the equivalent of Sydney Opera House over your head?
Well, we all have our little peculiarities. You're even going out with one.
Will you please not drag this conversation down into the gutter?
Why not? That's where you found Paco.
We are discussing a patient.
All right. When Mr. Barraclough works out, his body releases endorphins into his bloodstream.
That is normal in any athlete.
Yes, but I think Mr. Barraclough gets an actual high from it. A high to which he's become addicted.
Rubbish! There is no medical evidence for that whatsoever.
Will you, for one moment, get off your high horse? It's knackered.
How can anyone of your intelligence be taken in by all these quack theories?
Because I have an open mind.
There is nothing wrong with that man that a good shrink couldn't cure.
That's what I'm talking about. He has not just been difficult, he's got a problem.
Oh, of course he's being difficult. I had less trouble following wild palms.
You said yourself. He needs to see a psychiatrist.
He ought to see a taxidermist.
Look, if he agrees to see a psychiatrist, will you agree to operate on him?
Yes, all right, I will. Oh.
Yes! I enjoyed that.
You beat me. Never done that before.
Of course I have. Hundreds of times.
Well, if the truth be told, I rather enjoyed it too. Why do I feel as if we both ought to be smoking a cigarette?
Yeah. Well, I've got to be going.
Me too.
Sheila, can I give you a lift home?
1,
I don't see why not.
2, 3,
What on earth?
4, and 1. 2, 3, 4, and 1. 2. Come on, Giles. Bend those knees.
Oh, my God, I think I've burst something.
Well, it's good to see that some people are trying to get into shape. I think you could all do with joining in this class. Well done, Michael.
Excuse me. At the risk of being pertinent, the only exercise we ever see you do is thrash him about.
Right, precisely. You're saying we should do physical jerks. What about you?
Well, I don't need to. I'm perfectly supple.
Ah, yes, perhaps you could grace us with some evidence.